with people with disabilities in order to also raise the issues of the disability, people living with disabilities up. Jacques is going to run the first part of the program immediately after the welcome remarks and introductions by Mutumone Piti, and then I'm going to come in later on. So can we please welcome Mr. Mutumone Piti to render the item of the words of welcome and any introductions.
Thanks, Program Directors, Honorable Minister of Health, Dr. Joe Patha, distinguished guests, ladies and gentlemen, all protocol observed. Batswami Lucy Dumela. And morning to all of you who are here. I'm just here privileged to welcome you and say welcome to this very important event on the Rotary Family Health International Health Day. So I just want to say on behalf of the people of Tshwane and Melus in particular, that we are welcome and we welcome the opportunity to host this event and believe that we'll all work together across all levels of society in building a strong partnership for the delivery of health services in the areas where we live. Welcome.
I had asked him to do introductions, but he's chickening out. So he chickened out of it. He says I should do it. I'm going to introduce people who are here with us because it's quite important for us to acknowledge their presence. Of course, in our midst, we are mostly honored today. And as far as I can remember, the Rotarians are always honored to have the presence of the minister throughout. It doesn't matter where they go. They somehow manage to get the minister in their presence. So we have got the Minister of Health, Dr. Joe Pasha. He is the gentleman there with the Cuban shirt. Yes. He's the only one that I'm going to allow to greet us from the sitting position. The others are going to allow them to just rise. The second person I want to introduce, it's not in any order of seniority, really. I'm just going to follow the program. Sue Paget from the Rotarians, please, yes, stand up. You can see her there. I don't want to obscure her. Then we have got Sandra Kumalo. Is Sandra here? There is Sandra Kumalo. She's representing people with disabilities today. John Blamford is up there. He's the country director, Center for Disease Control and Prevention, South Africa. You normally call CDC. I think that's what you call it because it's a long title. And then we are so honored today to have in our midst what we call the resident coordinator of the UN families. So all the UN agencies, UNAID, you can call them, she actually coordinates all of them. She's Miss Nados Bekele Thomas. So they're over. And then we have, on behalf of the whole of civil society in SANAC, the chairperson of civil society and co-chairperson of the whole SANAC in South Africa. She's Miss Steve Litsike. Some of you may not have known, Steve used to be a fantastic soccerite. She can play soccer like nobody else's business. Yeah, she is very skilled with soccer. And then we also have in our midst the CEO of SANAC. We call her Dr. T. She's Dr. Kulu, Tembi Kulu. Very, very flamboyant lady. She's, as you can see, and sharp and getting things done. So behind all this and behind all of us, there is the woman who is actually pushing us all. So I think those are the people, the dignitaries in our midst. But the most important dignitaries in our midst are yourselves. So even though we are not going to be able to introduce you by name, you are really recognized and acknowledged, and we are most honored to have you in our presence. Thank you very much. Jack.
Good day, everyone. My name is Jacques Lloyd. I am a C67 quadriplegic after a diving accident in 1988. First of all, I just want to say a special welcome to my fellow people with disabilities here. I know it's not easy to get here. I know it's hot today, but thank you very much for taking the time off and coming to join us, and also having the opportunity to meet the minister. There's just one thing that I noticed now, as we are living in a desegregated area. You know, all the disability is that side, and all the people without disabilities are this side. I think we're going to have to change that next time. It doesn't really look good, but welcome in any case. I'm not going to take a lot of time. First of all, I want to introduce Sue Paget. She's the CEO of Rotary in South Africa, looking at family health and HIV programs. So thank you very much. I appreciate it.
Life is a gift, and it offers us, sorry, that's okay. I'm sure red is always absolutely fine. Okay. Thank you. Thank you. Life is a gift, and it offers us the privilege, the opportunity, the responsibility to give something back by becoming more. Good morning, everybody. Sanibonani. It's a great honor to be here in Malusi on this very special occasion. Honorable Minister Councillor, District Governor, District 9400 of Rotary International, Dr. Stella Anyangwe, all protocol observed. On behalf of the Rotary Action Group for Family Health and AIDS Prevention, I'm delighted to address everybody here today at this wonderful hybrid commemoration celebration of the 10th Rotary Family Health Day Public-Private Partnership in South Africa. A very special day that so many have worked so hard to achieve. Minister Pasha, it is very significant that you will be announcing the World AIDS Day theme here today as we lead up to the 1st of December. As many here know, the Rotary Action Group for Family Health and AIDS Prevention was started as a result of one woman's tragedy. A mother who lost her son in the United States to HIV who met with a committed Rotarian sometime later on in Africa who was anxious to make a profound difference in his country. Almost 11 years ago, in a village in Uganda, hundreds of Rotarians were waiting to see whether the surrounding communities would show up to receive the free health care they'd planned for the first time. They needn't have worried. Over 38,000 Ugandans queued for free screening for diseases including HIV and AIDS, TB, diabetes, blood pressure, immunizations, malaria, and more. The Rotary Family Health Days were born. It became clear then, as it is now, that community-specific health interventions were needed, that integrated health screenings allowed people to come forward for testing without the stigma that might be associated with singular screening, that the people using these interventions believe Rotary to be non-partisan or neutral and therefore trustworthy, that health delivery and funding partners contributing to these interventions felt the same, and finally, that driven by service leadership and volunteerism, Rotarians are happiest when working together on a common cause, directly benefiting their country and the communities in which they live. Since that day, I am proud to say that our program has served over 2.6 million people with over 11 million free health services in 9 countries in Africa and in Madhya Pradesh, India. We're very excited too, despite COVID challenges, to be launching programs later this year in Zambia, Zimbabwe, and early next year in Eswatini. The Rotary Family Health Days first came to South Africa in 2013, where we reached proof of concept, thanks in large part to the support and partnership with the South African Ministry of Health. Minister, I thank you. It remains a privilege for us to work with you and your department in our endeavours to improve the lives of our fellow South Africans. Rotary has always believed in disease prevention, epitomised by our fight to eradicate polio starting in 1985. It is important to note in today's COVID-19 realities that Rotary did this work through massive vaccination drives in partnership with the World Health Organization, the CDC, UNICEF, governments around the world, and a myriad of private sector partners. This crippling disease that has affected so many lives is now officially eradicated off the continent of Africa. It is all the more important as we acknowledge the inclusion of the theme of today to recognize and advocate for the people living with disability. We pledge our continued support to you as a crucial sector within our communities. Once again, we are facing a pandemic of devastating proportions. Based on the experience of the past, Rfhd, through the Rotary Family Health Day program, stands ready to play our part in combating the COVID-19 pandemic sweeping the world, and we encourage all South Africans to get vaccinated. Rotary Family Health Days will include free vaccinations at all future sites. And in conclusion, collectively, we are all leaving a legacy because we believe that the only way to combat disease and build a healthy nation of people is by working together. Here, every partner of ours, both here in South Africa and globally, is highly valued, and we sincerely thank you for working with Rotarians to make such a positive and meaningful difference in the lives of so many people in our country. I believe that every one of us is born with the natural instinct to lead a life of integrity through giving and service. We just need to find it in ourselves and to recognize it in others. In my humble opinion, there is no greater honor than service. There is no greater reward than service. And today, as all of us appreciate, there is no greater need. Together, we can do so much more. I thank you.
Thank you very much, Sue. Now I want to introduce someone that is very near to my heart and a very good friend of mine, and I want to thank her for taking the time off to come and talk about her challenges as a person with a disability, but also her victories and the excellent work that they are doing. Sandra, if you can come up, and once you're done, you can stay up here, please. I just, while she's coming up onto the stage, I just want to say that Sandra is playing a key role in a lot of the work that we are doing within the Department of Health to highlight the challenges that people with disabilities have. And I'm sure she'll tell us a little bit more about that. Thank you.
I just want to sanitize.
Good morning. Sanbonani ninjani nonke. Okay, I'm really honored to be able to speak on this platform on behalf of my fellow colleagues, rest of the disability sector, Honorable Minister, and all protocol observed. My name is Sandra Komalo. I got involved in an accident while I was on duty in the Kruger National Park back in 2005. I was working for Singita Private Game Reserve. I lost the use of my legs. I got paralyzed from waist going down. So I'm a T12 paraplegic. I'm a mother of 2 daughters. I had one before I had accident, the other one after accident. So it's possible to have a child after injury. I'm a South African Paralympian rower, 2-time Paralympian rower. I have competed in 6 different world championships in different countries across the world. I qualified with a silver medal in 2012 that got me into London Paralympics, London 2012 Paralympics. I won the B final in 2015 after being hospitalized, and I stayed for 8 weeks on bed. I had a pressure ulcer on my left leg. And what motivated me was I had to qualify for 2016. So my mind was focusing on qualifying, not on the sore. And I managed to heal fast and train very hard. And I won B final in France, qualifying into Rio Summer Paralympics. Thank you. Thank you. Thank you. I'm working with Convatec South Africa, supplying catheters called GentleCath. It's a self-catheter to adults and kids with spinal cord injuries. I'm a motivational speaker to newly disabled people and different corporate companies that are facing challenges or having it difficult to change, because we're very scared of change, and it's not nice to get into change, most of people. Yeah, I'm a co-director for Rfhd Rehabilitation and Research Consultants. With that capacity, I've been working very closely with Dr. Jacques Lloyd and National Department of Health, focusing on improving the life of people with disability, on health and wellness. Currently, we're working with her Voice Fund and looking at sensitizing young women and girls with disability on grade 12 level. With regards to gender-based violence and sexual health and reproductive rights, although we managed to roll out the program supported by external funders. The group consists of, the group that we worked with early this year consisted of 148 adolescent girls and young women with disabilities from 2 provinces in South Africa, that is Gauteng and Eastern Cape. This project sought to address this gap by gathering evidence on the needs and issues of adolescent girls and young women with disabilities. This project, is means to amplify their voices and to gather evidence to the health, also well-being and lives of the adolescent girls with disability. Our findings, 41.7% participants scored 25% and below on HIV knowledge, while about 56.7% highlighted they engage in sexual intercourse and engaging in risky behaviors, including risky sexual behaviors. I'm concerned about the fact that currently the last 4 years, the National Department of Health had not funded or supported any disability rehabilitation and health and wellness program. I would like to thank the Department of Rotary I would like to thank the department and Rotary International for the opportunity and to emphasize the needs with regards to this, disability health and also specific programs. Thank you. Thank you. With regards to gender-based violence, on a recent case study, I'm going to start by saying I realize as much as it is important to educate young girls and women with disabilities on sexual reproductive health and rights and how to identify abuse and violence, it is important to educate and sensitize parents and guardians, as they are the first points of communication and support for youth. Without educating parents and guidance, we cannot expect youth with disability and girls to communicate and ask to support and help from people closest to them. It needs to be a holistic approach involving everyone. Why I'm saying this, according to the case study that I got involved in recently, one of the young girls, adolescent girls with disability from one of the schools that I worked with, she goes to school, and after school, she goes back home, but the parents do not allow her to get out of the house. She's locked inside the house every time. She only go out when she go to school, and then come back, she stays in the house. So while they were at home that time, they were having an event, I think a braai or something, but she was kept inside and everyone was outside. Then she decided to take a bath. While she was bathing, she had footsteps coming towards the door. But she could hear this is a man, and the footsteps are getting closer to the door. And eventually the door got opened and it was the uncle. And we always teach the girls to scream as loud as possible. Even the next door has to hear you when you're screaming. So the child had to scream as loud as possible. And that's when everyone else came. But still, the mother was kind of defensive to that. They always want to block whatever that is happening. I don't know. I do not understand myself. It pains me, and it's something that is very dear to my heart to see this happening, especially to girls that are already vulnerable, and we're trying to take advantage of them. I hereby request an urgent meeting with the Minister and disability organizations to ensure that people with disabilities are not consistently left behind. Thank you so much for this opportunity, and I'm looking forward for your quick response. Thank you.
Hello, Sandra, thank you very much. It's always scary to listen to some of the things that you are talking about, and I think we are not made aware of that often enough. I'm now going to change the program just a little bit, and I'm going to ask the United Nations Residential Coordinator, Ms. Nados Bekele Thomas, to address us quickly. Thank you.
Thank you very much. Is it morning or good afternoon or good morning? It's still morning. Great. Okay. Good morning, everybody. Good morning, Minister. I want to just say good morning to all those that are here. Steve, my friend, the CEO of SANAC, the program director, and also Reverend, who was doing this job before, the CEO of I should read that, Rotary Family Health, the CDC, my wonderful daughter, I'm sure you'll be my daughter, Sandra, and very inspiring. Actually, after, her speech, there is nothing to say. There are many things that are loaded in the message that she put forward. The first one is that we can do it. If Sandra can make it, there is no way that others will not make it. So we can all make it. We need to be inspired by her, because she has got really, if we have to really mount all the challenges, this is a woman, one challenge. She's Black, two challenges. 3, she's younger, and then, she's a person with disability. So, if she can make it, we can all make it. And congratulations, Sandra. Thank you very much for being very inspiring. Thank you very much for being you. And God has given all this to you so that we can learn from you. And we are very grateful. The second thing is really to thank SANAC, with who we have been partnering all along. Steve, the new CEO, the charming lady, thank you very much. And the department, of course, that gives always the platform for this kind of partnership. And I would really like to recognize that and to say thank you to the Department of Health. As we all know, one sector will not be able to accomplish everything. If we need, and COVID has shown us that, just a microscopic, little bite of virus has caused such havoc. It wasn't only a health problem, but it was also a socioeconomic problem. It was, certainly a mental problem. It just changed the way we do things, the way we operate, the way we look at things. And therefore, for the Ministry of Health, since I have been here, it's always been this opening up the platform for a multi-sector discussion, a multi-stakeholder also discussion. And for that, I'm very grateful. And this I say because I've worked in many other countries, and Stella, who was the rep of WHO here, and who is now the governor of Rotary. I don't know what regional governor or, but anyway, you are the governor for me. So, you know, she would attest to that. It's very, very important, you know, for the health sector to open up and to understand that health issues is not just a confined one sector or one department's challenge. It's a multi-sector challenge. And therefore, you know, I'm so glad, and I have been inspired since I came here, that the department has this philosophy of really having a platform for all stakeholders to discuss the challenges and to come out with homegrown solutions. You know, at this time when we were faced with the COVID, again, the same thing happened. The whole country, South Africa, was leading Africa, but also leading the world. We do not want to admit it, Honorable Minister, but we had so much to learn from South Africa. South Africa was pioneering in the way it was handling the pandemics. I mean, we always talk about problems. We don't talk about the good things, but there were many, many good things that came out of South Africa. And that is thanks to the leadership. The whole society, whole government approach was something that was introduced here even prior to the pandemic. Unfortunately, you know, while the DDM program was being implemented or started being implemented, then the pandemics came and it halted everything. But certainly, I mean, such things should not deter us from going forward. Such things should really be a clarion call for redoubling the efforts and accelerating the speed at which we deliver things. And Honorable Minister, the United Nations is there with you. I know that you're working with WHO, but there are other agencies, the UNFPA, UNAIDS, UNICEF, that is also in the health sector. Today, you know, I came here because, you know, I was calling my colleagues and I said, are you going to attend this important event? For me, important because of the fact that we are addressing the Leave No One Behind agenda, which is our priority agenda. And it talks, you know, to the challenges of people with disability. And I cannot be not here with all my limbs functioning. There is nothing that I cannot cancel to be here. I had so many appointments, but then because my colleagues would not make it, I said I have to be here. And thanks to my sister, because I know that, you know, if I don't come, Steve will call me and, you know, scold me. So, you know, I have to make sure that I am here so that, you know, I comply with her demands. But most importantly, from my heart, you know, I am with you. And we just had a very important, but very educational, very informative summit in Cape Town, no, in Durban, you know, with people with disability. They were the ones that put the agenda. They were the ones that put the program. What we did was just to listen to them and really translate all that in terms of actions, policies, and strategies. And the eThekwini municipality was very helpful in doing that. And therefore, you take leadership. Take leadership. Look at Sandra and let's get inspired. And you know, I'm so glad that I'm here, but I want to pledge the entire UN system's support to all the issues related to people with disability. They are enormous, and it requires a very integrated, multidisciplinary, multi-stakeholder approach, and we can do it, and you can do it. And I would like also to pledge our solidarity with the Rotary. It's just so wonderful to be here, because in any case, the Agenda 2030 will not be made until we have these, you know, joint effort, collaborative effort, everybody coming together. The anthem, the South African anthem, tells us to do that. Let's work together. And we are here to say we will walk the talk together. And Minister and Sanak, we're always with you. We're here as international civil servants. And you should know that. We are your international civil servants. And therefore, you dictate to us where and what to do, and we would follow you. I thank you very much. And CDC, thank you very much. Thank you very much.
Thank you very much for those inspiring words. I think especially the pledges will be taken up, I'm sure of that. Thank you very much. The next speaker I want to introduce is Dr. John Blamford. He is the country director for Center for Disease and Control and Prevention in South Africa. And he's just going to talk us about a little bit about the importance of health partnerships for creating and reach the most vulnerable and needy in our societies during times of COVID. Thank you, John.
Am I okay with this microphone? Dumelang, and good morning to all. I'm honored to be invited to participate today, to be in the presence of the Honorable Minister, Dr. Joe Patla, to be in the presence of the large community of people living with disabilities, and to all the other dignitaries who've gathered today. Please, all protocols observed. I want to thank the Rotary Action Group for Family Health and AIDS Prevention and Rotary South Africa for inviting me to join and offer a message of support, and a message of support from the US government, but also a message of support for the partnership that made today and similar events possible. CDC South Africa continues to be proud to be associated with this event, and congratulations on the amazing effort as you rolled out this initiative for, is this the 9th consecutive year or 10th? 10th year. So it's an amazing accomplishment. And I think the goal is really important, which is to bring free, comprehensive, holistic healthcare to those who need the healthcare most, who have the most limited access to the healthcare that's needed. And the holistic is important for two reasons. As Sue mentioned, it's important because it allows us to screen for diseases for which there is stigma. Diseases such as HIV, tuberculosis, and to do that screening in the context for screening for diseases for which there's less stigma, such as high blood pressure or diabetes or cholesterol. And so it allows that holistic approach is really important. The US government has been proud to partner in South Africa on the HIV and TB responses since 2004, and has to date invested more than 100 billion Rand over those years towards the HIV and TB responses. We can only do that in partnership. Under the leadership of the Ministry of Health, the National Department of Health, working in collaboration with provincial departments of health and district departments of health, civil society, the private and NGO sectors. We understand the importance of partnerships. And we also understand is that we joke that the CDC's official name is quite long, or the Centers for Disease Control and Prevention. And I wanted to emphasize the prevention part. One of the things that's so important is to be able to provide these screening services to detect these diseases, or that both infectious diseases and non-communicable diseases, and to identify those early so that they can be treated and people can have long and healthy lives and not pass the disease on to someone else in the context of infectious diseases. We have to commend the National Department of Health for the work they're doing through the Check and Pilo campaign, and to endorse and encourage a healthy lifestyle overall. What we know with HIV is that with diagnosis, early treatment, and now for treatment that's as simple as 1 pill per day, patients can get the viral load so low in their body that it's undetectable by laboratory tests. So the virus is, there's so little virus in the body, and if you maintain your drugs every day, if you take that drug every day, you maintain a low viral load, so low that not only are you assuring yourself of a long and healthy life, a normal life, but you're also assuring yourself that the virus can't be passed on to another partner as long as you continue to take that drug every morning. So I'm saying this as a director of CDC. I feel this passionately on a professional level, but I also want to share something with you on a personal level. It was at a community testing center when I was 24 that I was diagnosed with HIV. That was obviously many years ago. I was lucky enough to get access to drugs in time to get me where I'm at today. But I think that what's interesting is that my HIV treatment now is quite simple. It's one pill once a day. When I go to see my doctor, though, when I go see a healthcare worker, what are they most focused about? My blood pressure, my cholesterol, how's my blood sugar doing? I'm now 60 years old, so I'm facing different diseases as an older man. And it's important to think of people, as the community of disability has pointed out, that everybody has health needs and needs access to those health needs. And we need to be able to incorporate that and integrate that and do it in ways that are accessible, that are accepting, that are welcoming. I do want to take advantage, in addition to our work in HIV and TB, CDC is also deeply invested in the detection and prevention of respiratory diseases, including seasonal influenza and COVID-19, of course. So I do want to encourage you to take advantage of vaccination. I know right now, both nationally and Gauteng province, the current rates of new disease, COVID-19 disease, the positivity rates are low right now. We're in a lull between waves, but the fourth wave is coming. Please get vaccinated. Please get your friends vaccinated, your family vaccinated. This is the opportunity. Just as we were talking about holistic healthcare needs for the individual, we need to think holistically about the community. For those who are my age or older, clearly we want the vaccine because we need it to protect ourselves, to avoid serious disease, to avoid death. Others, even younger, are also at risk. We all know we've all been affected by people who have had COVID-19 and at younger ages who have gotten ill and have died. But even if you're feeling very strong, if you're feeling very robust, get vaccinated to protect your parents, your grandparents, the children in your household are too young to get vaccinated. So please take advantage of all the services that are offered today. I do want to congratulate this collaboration, RFHD, the NDOH, the provincial and district departments of health that made all this possible today. And thank you for letting me join.
Thank you very much, John, for that inspiring speech. I would like to now introduce the CEO of SANAC, Dr. Gulu, to just tell us a little bit about what SANAC is doing with regards to the activities. Thank you.
Sanbonani, good afternoon. Program directors, Dr. Jacques Lloyd. And I did have to say Dr. Jacques Lloyd because he did get his PhD 2 years ago. Reverend Zoe, thank you, Mfundisi. To the Honorable Minister of Health, Dr. Joe Patla. To the SANAC co-chair, Ms. Steve Letike. And it would be wrong for me to be called vibrant and not to recognize our hosts for today. So, ngicela ukubingelela ubaba acting DDG for Hospital Services, Dr. Freddy Khongwana. Ngicela ukubingelela ubaba District Health Manager for Tshwane, Mr. Pizzi. And then we are also aware that in the room we've got the DDG of the Gauteng Department of Education, or Mr. Vuyani Mpofu. Let me then, in absentia, also greet the President-elect of Rotary International, Ms. Jennifer Jones. The CEO did say she's still asleep at this hour, so I'm greeting her in absentia. Ms. Bekele Thomas, who has just left us. Dr. John Blamford from the CDC, the CEO of the Action Group for the Rotary Family Health and AIDS Prevention, Ms. Sue Paget. Ms. Sandra Kumalo, and the entire disability sector. Thank you, Sandra, for being such an inspiration. It's true. And people with disabilities, thank you for being here. Let's just give Sandra another warm round of applause. To our media colleagues, our esteemed guests and friends of the Rotarians, Professor Stella, and I think we also have a birthday girl, Lisa Marie. Happy birthday. So the charm is on high today. I have been told to keep it short. So my name is Dr. Thembisile Xulu. I'm the Chief Executive Officer of the South African National AIDS Council. So the SANAC is a national body which is established by Cabinet to coordinate the multi-sectoral response to HIV, TB, and STIs. The council is chaired by the sitting Deputy President, currently the Honorable Didi Mabuza. And we are here today as part of the Rotary Family Health Days, a partnership that affirms the fact that we need to work much harder in bridging the gaps between the haves and the have-nots, especially because we know that abject poverty and lack of access to services always creates substantial challenges in terms of our response to HIV, TB, and STIs. These social challenges can also be a heavy breeding ground for gender-based violence and femicide, as we witnessed recently with the COVID-19 outbreak. The advent of COVID-19 has hit harder on disadvantaged communities. It has also halted the little economic opportunities that they have been relying on to make a living. Restricted movement during the hard lockdown made it very difficult for poor communities to access basic services, and the living conditions, including lack of access to water, still makes it harder for them to observe the COVID-19 safety regulations. The lack of adequate communication mediums at community level also means that there is lack of information about the virus. And this continues to spread fear, anxiety, and continues to spread conspiracy theories and misinformation, and therefore increasing the whole issue of vaccine hesitancy. Ladies and gentlemen, the effects of COVID-19 in reality stretch far beyond what I have just described. But of bigger concern to SANAC, as the program director has explained, are the negative effects that the pandemic has had on the HIV, TB, and STI services. And this has meant that we have struggled in terms of reaching our goals of the NSP. We are struggling towards reaching the 2030 NDP goals, and also towards meeting our sustainable development goals in terms of our international commitments. In terms of reducing access to HIV testing and treatment, we saw that the negative impact of COVID-19 was actually visible beyond that. There was a significant reduction in programs like medical male circumcision, as well as a reduction in the distribution of male and female condoms. And in the early days of the hard lockdown, we also witnessed that people were missing their clinic visits for the periodic health assessments and also not accessing medication. So in an effort to mitigate against the impact of COVID-19, SANAC then lobbied for the integration of TB and HIV services into the country's COVID-19 response. The Department of Health was extremely receptive to this, and that subsequently led to resolutions such as the following. One, the integration of COVID-19 screening into routine HIV and TB screening and testing services. And this is aligned with WHO recommendations and form part of the key catch-up plans, which I'll be describing in a while. We also intensified the multi-month dispensing of antiretroviral therapy to make sure that people limit the visits to health facilities, but also to encourage treatment adherence. Community and home-based arts dispensing were also expanded. And then we also increased what we call the CCMD, or the Central Chronic Medicine Dispensing and Distribution Services for stable patients. When we looked at the midterm review of the National Strategic Plan in 2019, which is for the period 2017 to 2022, we were trying to review our progress towards the 8 goals of the NSP. And we noticed that we were not on track to meet our targets even before COVID hit us. When COVID-19 happened the following year, it derailed us even further. And despite these challenges, I would say the country was able to meet the first 90. However, we have failed in terms of meeting the second and third 90s. SANAC structures were then extensively consulted and took a decision to defer the conclusion of the current NSP by a year and therefore delay the drafting of a new NSP. This was to allow the country to implement catch-up plans, which aim to reinvigorate and accelerate efforts which propel us closer to meeting our NSP targets, and subsequently bring the country closer to eliminating HIV, TB, and STIs as public health threats. We put together an NSP reference group, which was led by the Department of Monitoring and Evaluation together with civil society. And the focus was really to prioritize the revitalization of prevention, the integration of HIV and TB and COVID, the scaling up of antiretroviral therapy and TB services, and making sure that people that fell off treatment during the hard lockdown were welcomed back into care and retained in care in order to make sure that the viral loads are suppressed. Because as Dr. Blamford explained, once your viral load is suppressed, your level of infectiousness is so low that your chances of transmitting the virus to the next person are minimal to almost non-existent. The aim is also to improve the multi-sectoral response and to lead interventions which address the elimination of stigma and discrimination, as well as to lead community literacy programs on COVID-19 vaccination. Ladies and gentlemen, I think it is Disability Month, and we are aware that people with disabilities face certain challenges in terms of accessing basic services, including health services. And through initiatives like the Rotary Family Health Days, we hope to sensitize decision makers on the plight of people living with disabilities. We need health and social reforms to ensure that people with disabilities and those with special needs are not left behind. When you look at the community that we are in today, we'd really want to appreciate the Rotary Family Health Days for this initiative, because as a country, we need to work harder to ensure that health services are delivered to disadvantaged communities, the ones that are especially in harder to reach areas. So to our international Rotary Health family and friends, we remain grateful. We look forward to an ongoing and stronger relationship in years to come for the ultimate benefit of all South Africans. Ngiyabonga. I thank you very much.
Thank you very much for that inspiring message and the good work that you are doing. I'm now going to introduce the Rotary International President-elect. She is, as you've heard, Ms. Jennifer Jones. She's been part of Rotary since 1977, and she's the first female president elected in 115 years. So fantastic. Thank you very much. We're going to listen to a recording message from her. Thank you.
Greetings to you all. It is an honor to participate in this year's Rotary Family Health Day, and my greetings to all esteemed guests. Rotary's commitment to Africa began 100 years ago when the Rotary Club of Johannesburg was founded. Our membership is growing across the African continent, and today there are well over 20,000 Rotarians in 800 clubs in 51 African countries. And last year, we were overjoyed to celebrate one of our organization's greatest achievements, helping to eradicate polio across the African continent. The march toward reaching this incredible milestone began with a call to action by Nelson Mandela 24 years ago. Your president challenged African heads of state and leaders to kick polio out of Africa. That came at a time when polio was still paralyzing 75,000 African children every year. Rotary was proud to lend our support to President Mandela's call, and working together with African governments, religious leaders, concerned parents, healthcare professionals, volunteers, and donors from around the world, we reached every corner of this continent with polio vaccines, even the most remote and politically unstable areas. And now, about 220 million children across the African region are immunized against polio every year. The declaration of Africa as wild polio free was such an important moment because it demonstrated how much we can accomplish together when we have visionary, courageous leaders and global partners willing to make commitments that not only take years to achieve, but then leave behind resources that can be used in other future battles against other deadly diseases. Fighting disease is one of Rotary's main areas of focus. When the COVID-19 outbreak began, our members were already supporting efforts to promote proper hand washing techniques, teaching people other ways to stay healthy, and supplying training and vital medical equipment to healthcare providers. Our clubs immediately stepped up with grants that assisted health authorities in communicating life-saving information about COVID-19. We also donated protective gear and other supplies to clinics and hospitals worldwide that were under strain because of the pandemic. Now, Rotary is fully engaged in helping countries break through COVID-19 vaccine resistance and ensuring that effective vaccines are available worldwide. For decades, Rotary has been highlighting the power and efficacy of vaccines. Our tenacity, strategic partnerships, and innovation are helping to protect communities from COVID-19. I am excited to share with you that our Rotary Foundation has signed a memorandum of understanding with Gavi, the Vaccine Alliance, which is an implementing partner of COVAX, to facilitate the equitable distribution of vaccine and to encourage demand for vaccination in a select number of countries in Africa and Asia. Through this initiative, we will be utilizing the strong networks Rotary has built that have proven to be so successful in our polio eradication efforts. Rotary Family Health Days have a 10-year history in South Africa, and we know that this year's event will help make progress in vaccine uptake across South Africa, while also providing other vital free healthcare services. Since the inception of Rotary Family Health Days in 2011, globally, more than 2.5 million individuals have benefited from more than 11 million comprehensive free health services rendered conveniently outside of health facilities. This is all part of taking health services to the people, saving them travel and transport fare. By visiting a Rotary Family Health Days site, people will have universal access to a wide range of screening, testing, and counseling, and referral for a broad range of disease and healthcare conditions. We're also overjoyed that these days are helping to provide services to people with disabilities who too often fail to receive proper care and attention for a wide range of needs. For this reason, people with disabilities are included within all Rotary Family Health Days programs and projects, ensuring that the maximum number of people with disabilities are reached. Whenever possible, special attention is paid to the specific needs of deaf, blind, and physical and psychological disability populations to ensure that everyone is empowered and resources are made available to address their unique challenges. Over the past decade, Rotary Family Health Days have served 230,000 people in South Africa from all 9 provinces and have provided free access to approximately 750,000 individual free services. We're gratified by your partnership in helping these days to continue and to thrive. We're proud of our impact and eager to expand that impact as much as we can, because Rotary is all about service above self. We are truly a global organization, and we know that it's our diverse perspective that helps us to tackle the world's most pressing challenges. We seek out and are energized by alliances and friendships with like-minded people from all walks of life who share a similar commitment to making the world a better place. No matter our backgrounds, we're drawn to each other because we know the power of our service. We've all felt it. We know the mysterious, powerful force that service creates, something aimed at others that ends up enriching our souls and creating greatness. American civil rights activist Martin Luther King once said, "Everyone has the power for greatness, not for fame, but for greatness, because greatness is determined by service." Thank you for your support of Rotary Family Health Day and for your commitment to brighter, healthier futures for your citizens in everyone in the world. Thank you so much for your kind attention.
Can we share the message again? Wonderful message. Coming from Ms. Jennifer Jones, the Rotary International President-elect. Wonderful. She's not able to be here, but she was here. We managed to be with her, listen to her. The event like this, as we're sitting here, are primarily not for people who are sitting here. It's for hundreds and thousands and millions other people who benefit from this platform. And so let me introduce to you a very short man whose work reaches millions. His name is Mr. Nelson Dlamini from the SANAC Secretariat. He's our communications officer. Nelson, please rise so that they can see. He's right at the you can't even see him. But yeah, he also works with a tall man, so they complement each other. Where's Foster? Foster, I mean, these are very important people. I know that we can forget to introduce very, very important people who do amazing work and make sure that all this work that we are doing actually benefits millions of people who are out there in many other provinces. And with those words, I'm going to invite to the floor Ms. Steve Litike, the co-chairperson. In many respects, he represents the office of the chair. She represents the office of the chair in SANAC. So in the place of the DP today, we have got Ms. Steve Litike. Over to you.
Thank you so much, program directors. I thought maybe it might be fitting because sise boardroom somewhere, but ngifuna ukuthi sicule kancane sithi vavavum before uminister azokhuluma later on. Liyakwazi ukucula la ithi ropela aropele ngherere magwala acheche le morao ho ya rona akelutsi le song magwala acheche are yemelle ho ya rona ho ya rona ho ya rona ho ya rona ho ya rona. Those who can't sing can just clap their hands to join in. Ho ya rona bapelo. Le song magwala acheche. Ho ya rona bapelo tse thata. Le song magwala acheche. Ho ya rona. Auzo. Ho ya rona. Ho ya rona. Ho ya rona. Amandla. Viva people with disability, viva! Viva SANEC, viva! Viva Rotary, viva! Viva Department of Health, viva! Viva civil society, viva! Viva key population, viva! Viva Rotary, 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 Rotary! Ebe go tsena le moya. Wa ngena no moya. And there was oxygen flowing in. And we needed that. We needed that. We have been through quite interesting past few days, few weeks, where elections were taking place, and we cannot take for granted our democracy that was fought for. Now, let me send my greetings, of course, to the Honorable Minister of Health, Dr. Joe Phaahla, who's a comrade, who's a leader in society, and who's leading, of course, the Ministry of Health, tsa bophelo. Greetings to the Rotary family. Sibonge kakhulu to the president-elect who's not here with us, but we have the whole delegation led also by the CEO of Rotary family, Mayor Paget. Let me send greetings to the civil society, national leaders who are here. I saw few from the sector of persons with disability. Comrade Jacques, who's also the core program director. I saw representative from the labor sector, representative from the traditional leaders who are here with us, and all other sectors that I may not have laid my eyes on. But we thank you for joining this most important program. Greetings to our host province, Gauteng, Egoli. Thank you so much to the Department of Health, Acting DDG, and also the Acting DDG from DBE, first to Dr. Huani, and also Mr. Mpofu, and our Secretariat of the AIDS Council. So I'll start first with our CEO, Dr. T, who really is amazing in what she does. But here in Gauteng, we have, of course, Bumme Iris, who's leading the coordination in the province. So thank you so much, Me Iris. When I was listening to Reverend Zoe talking about when the Rotary activity or intervention was first launched here in Gauteng, in Mogale City, I remember very well, Me Iris was still working, and here we did not have the Gauteng AIDS Council as we have it, we call it now, but it used to be Msau. And when it was launched, the program also was coordinated from Msau, Multi-Sectoral AIDS Unit in the Department of Health. So the history, here we are and we are back here, and Gauteng still leads. Now to our host city, Mr. Pitsi, who's a very good friend and comrade as well. Releboge, Chief Director, because your work, we know it. It has shaped many lives here in the city of Tshwane. All leaders who are here, all representatives from various departments, officials, from civil society groups, private sector, colleagues, and the community of Melusi. Thank you so much for hosting us. It is, of course, a privilege to join the 2021. I must apologize to my comrade here from CDC. I just realized I did skip there. These fonts are very small. But Comrade John, who's the country rep for the Center of Disease Control, who's a partner to our country. Colleagues, it is a privilege to join the 2021 commemoration Rotary Family Health Day. Today, we are celebrating a truly multi-sectoral partnership supporting the community of Melusi with access to, amongst other, healthcare, nutrition, education, and more recently, an expansion of COVID-19 health and social support services. Of course, we need more such programs where it includes local collaboration and the network of NGOs, community-led organizations, faith-based organizations, traditional leaders, organizations, and volunteers to strengthen the success, one of a truly right-based, people-centered programs and taking the health response forward in communities. Both the successes and failures from our health system response have taught us that we cannot prepare for or defeat any health threats unless we tear down inequalities. We need to promote people-centered approach. We need to work together in partnership with communities to reach everybody in need. Of course, the Department of Health have in the past introduced what we call an ideal clinic. And I remember Minister of Health, when the department called all of us to engage, we were put in, I don't know what is that place, Ntatepiti, in the east of Pretoria, for weeks, designing what is called the ideal clinic for South Africa. From when somebody has to walk to a facility or be taken to a facility, what are the signs? To entering a clinic facility, what are the signs? Communication. And how do we even communicate and the service itself? So the package, when the department called all of us, was the idea of universal health coverage for all. Whether a person is with disability, a person is a sex worker, a person is a lesbian, gay, old, young, the ideal clinic model was a universal health coverage. And I think the department needs to be applauded for that approach. Now, our health system on its own cannot operate alone without key stakeholders surrounding the health system. Now, all these lovely organizations, tents that we see outside, represent the hard core of what we believe is a better health care approach within communities. Civil society organizations and communities also realized it is important to work together. And I think we are fortunate for a province like Gauteng, because Gauteng became a template for many other provinces. KwaZulu-Natal also did with Operation Sukuma Sake, and many other provinces followed. But let me tell you with regards to Gauteng, because Gauteng did not only wait for development partners to support the community system strengthening. Gauteng, in fact, invested resources and support to communities and organizations to respond to the health system. And I think it's quite important that we don't lose this gains of a model of a province. When you go to districts and metros of Gauteng, you find collaboration with community groups. And I think this is a clarion call to development partners. When you go into the city and when you go into the province, check who is there and how can you upscale, not establish new parallel process, because that is disruptive. And my friend, Comrade John, I hope you can hear that part of how do we upscale and sustain the work of provinces. Now, with this rich history of communities being at the center of health and progress in continuing towards the 95 targets set by UNAIDS, communities at the center will show, however, that progress towards these targets will vary greatly, province by province, and by district and local. We can do this work when we defend the marginalized, the left behind communities. The slogan of nothing about us without us started with the movement of people with disability. I want us to remember that. The slogan of nothing about us without us started with the movement of persons with disabilities organizing themselves and saying that we matter and you cannot speak on our behalf. We are here, we are capable, and we can do it. And that's a very important thing. Now I want to say, today marks the 8th annual Rotary Family Health Day, the outreach day, where even when our government in 2020 made commitment and assurance, particularly around NHI and ensuring that all services are universal, the role of civil society must continue because it's about the greater impact. And the greater impact, which is the work that Dr. Kulu spoke about, which I don't want to repeat. The National Strategic Plan is our intended effort of reducing HIV infections, addressing TB and STIs. Now, my message to my comrades, my friends, persons with disability, we know sometimes we think when we speak HIV, we don't want to talk about realities and examples that we can always refer to. Often people think that people with disability don't have the sexual, reproductive health and rights. Let us not deny persons with disability their bodily autonomy and respect of their sexual, reproductive health and rights. People with disability can space their reproductive approach, and they can also be respected for that matter. We need to also address the gender-based violence that people with disability experience. In this community, Melusi community that we are here in, I was saying to the minister earlier that a few years ago, this community did not exist. And I say this because Nakitwa Pelendaba, just a few kilometers from here. But minister, I want to say something about what has happened to see that our government responded to the needs of people with disability. There was, where we are, if I tell you 6 kilometers from here, there's a school of person with disability. If you don't know, there's what we call Church Street, but nowadays they call it Nkomo Street. Church Street, there's a school when you turn by Trans Orange Street. And then when you go 20 more kilometers from here, there's a disability center where people with disability were also given opportunities to empower, build skills beyond the academic element of it. In each of these communities, Atteridgeville, Soshanguve, Mamelodi, you find schools that are inclusive of persons with disability. And those who may have mental challenges, there were schools, again, there's what we call Zodwa School, just about 22 kilometers from here. I wanted to say this because these are services and programs that were there before. And when communities grow, we must make sure that we build more because population is growing and we must make sure those services are there. I think it was important that we remember that even this center that Rotary family has put forward in Melusi community, it's not just a center, but a center that offers training services, it's youth center, and people of Melusi must utilize this space. Access your services without doubt and fear because the services will be non-discriminatory for you and your families and your loved ones. The idea of a Rotary family, it's a unity amongst people. And if we are people, we will extend our hand and work together. And we believe as SANEC, our responsibility, as Reverend Zoe said, government, civil society, private sector and development partners, we come together and we respond together and we achieve together. Thank you so much, program directors.
Thank you very much to the chairperson of the civil society for the whole of South Africa when it comes to the HIV, STI, and TB response. We have an entertainment musical item. Is it there? Where is the short man? I call him Lord Nelson. He's not there. Okay, so I'm going to jump this one. I'm going to move to the next item of the remarks and introduction of the minister. So we are really moving towards the end of the session today. It's very hot, but it's very interesting here. I am so relaxed. Wish we could stay much longer, but I'm sure that it's quite hot here. So I'm going to invite the DDG for hospital services in Gauteng. And the CEO was saying he hopes you know your minister because there was a session she attended where a very senior official of the Department of Health was asked to introduce the minister, and the person was completely lost. They did not know their minister. So I hope, Ms. Dr. Hongwane, you know your minister. So over to you for your remarks on behalf of the MEC for Health, and then you can invite the minister.
Madam Akhaitsu, Sanbonan, Aitada, who's it? Ah, it's great. Honorable Minister Joe Pastor, I know the minister. I want to point out that it's okay. I'm here representing the MEC, Dr. Namatemba Muketi, and I'm here Bahaichu Koto Buisa, MEC Nato Subua, Hurutweta, Lezazile, Lelman non Toto, Lezazile, Lelmolotana, Lezazile Tumedisan. This day that is so gracious. Yakensa, Realobuha, the man. Greetings to you, Minister Jokata. Greetings to the Minister's Deputy in his absence. Greetings to the Premier in his absence also. Greetings to the Rotary International President-elect in her absence also, Ms. Jennifer Jones, but we saw the engagement. Greetings to the Chairperson of the CSF, Ms. Steve Letsike, and thanks for the singing. It was Baba Boom. It was really Baba Boom. Greetings to the Director of Centers of Disease Control and Prevention, South Africa, Dr. John Blamford. Greetings to the Chairperson in his absence of the SABC, Mr. Bongani Makatini. Greetings to you, Ma'am Paget. Greetings to the Deputy, the Chief Director of Tshwane District Health Services. Greetings to Dr. Madonsela, also is representing the programs, which the HIV program, the partners are waiting for. Greetings, Dr. Kulu. I heard that you are awesome. And please sustain the awesomeness. Bahaicho, I'll start by Makumalo. She was sitting next to me. And when she was called to the podium, I said, "Can I help you, ma'am?" She gave me a very strong no. That really touched me, and it's very inspirational, you know, that she said, "No, I'm full." But obviously she had to have some assistance in a normal world to go up the ramp. Now I understand that you are a champion international. But beyond that, the championship of the determination to survive. But more than anything, the determination for it. Utuse wakahabaluna. Ne? Bar malboko dinte a tibana. Izanda zakeza. Rosanzori, let's go pipi ne yati depende grass. You must crush my back, I crush your back. Let's crush each other's backs. The MECs allowed the minister just to be free to represent her appropriately. We are gathered here today to be part of the 2021 annual Rotary Family Health Day outreach program as part of ongoing government endeavor to deliver healthcare services closer to communities. The community of Emelusi, Gomora, Melusi, Hercules, Agir, Zanfontein, Haufili, Rangagata, exactly. The Rotary Health campaign, in partnership with Department of Health and other stakeholders, have touched the lives of many people through improving access to essential health services, which include HIV testing services, body mass index, immunization and screening for diabetes, TB screening, hypertension, amongst others. This campaign started 8 years ago, providing health education to the public and stressing the importance of regular health testing and screening. Through this campaign, the substantial number of people are expected to attain a lengthy and healthy life, which is very, very important, and as part of the NHI, and as part of the key objective of our government for the health of South Africa, our beautiful country. The Rotary Health Family Day campaign has assisted immensely in ensuring the communities are afforded an opportunity to detect and prevent health problems at an early stage before they develop into something serious. I'm hoping that we have the key theme of disabilities, that we also need to identify those disabilities very early in our facilities and also in this hub to test for hearing, eyesight, and so on. That is very, very important. It has also helped to prevent serious illness before they become chronic, thus saving medical bill expenses for a lot of people. I think it's also about dignity, the dignity of existence, the dignity of life. Furthermore, Bahaicho, the Rotary Health Family Campaign has provided necessary boost to the United Nations General Assembly political declaration on ending HIV/AIDS through the 1990 targets. And I think, Dr. Klu, you expressed it, that we still have a challenge with 2 of those indicators, and we will still have to work hard. Itatira, re tla dira, re tlo shuma ngamandla to make sure that 1999 is done as the Department of Health in Gauteng, in partnership, in collaboration with all stakeholders. This ambitious target indicates that by 2020, 90% of all people living with HIV will know their HIV status. 90% of all people with diagnosis of HIV infection will receive sustained antiretroviral therapy. And the 90% of all people receiving antiretroviral therapy will have viral suppression. And also we need to take notes out of the HIV program, you know, that there was a clear determination in our country to say, this disease will not deter us, will not stop us from developing as a country. And there were very serious decisions, and we are a benchmark. And we need to sustain. Sustainability, sustainability. The overall objective of UNAIDS is to bring HIV testing and treatment to the majority of persons living with HIV, reducing the amount of HIV in their bodies to undetectable levels, just that they remain healthy and prevent the further spread of the virus. I think the same attitude we take to HIV, we need to take to COVID-19 and any other pandemic. Henceforth, we must be mindful that the advent of COVID-19 global pandemic had an adverse impact on viral load of many people living with HIV, TB, diabetes, and hypertension, amongst others. Severe interruption in treatment of such illness can result in additional fatalities related to those medical conditions. We have to be determined that we will overcome. Therefore, it is encouraging to learn that the Rotary Health Family Campaign will be commemorated in compliance with COVID-19 risk-adjusted strategy and protocols to reduce the prevalence of the virus. And you can see we are having a lot of ventilation, and the gods gave us a lot of air that came into this tent, this marquee. This campaign has resulted into a significant gain in treatment effectiveness, as well as increase in the number of people who know their medical status. A healthy economy needs healthy people. You cannot have a healthy economy without healthy people. So this is a very key and a very important, you know, initiative to make sure that we also recover economically, we reboot, you know, we reconstruct. Re thome go aga seswa, re tiishe, la kwešiša, re shape COVID ding dong. Let us then commemorate the monumental humanitarian health initiative aiming to achieve the foremost objective of primary health care. This is a positive avenue to provide an enabling environment to the general public to seek basic health care and be afforded the opportunity to practice preventative measures and live a longer, healthy lifestyle. President Bobani, after the elections were announced, the results, the electorate says we must work together. This terrorist called COVID-19, HIV, TB, and all health problems, including Buhuma, we will work with you, Maggie. Siabong, I thank you. Ladies and gentlemen, it's my honor and privilege to introduce our Honorable Minister of Health, Dr. Joe Patha, to the podium to guide us further. Leadership.
Thank you very much. Thanks, honorable guests. We can take our seats. And thank you very much to Dr. Khongwan on behalf of my colleague, the MEC for Health. The message has indeed landed into our ears. Thank you very much. Let me greet also our program directors, Reverend Zoe and Dr. Jack. I've already recognized the representatives from Gauteng, the delegation led by Dr. Freddy Khongwan on behalf of the MEC and the Premier. Our CEO, Dr. T, spoke very well to us here. Indeed, doing a very good job in driving the SANAC, working together with all the role players, the trust, civil society, and all the other role players in SANAC. Our important guest of honor today here on this very important day, the CEO of the Rotary Action Group for Family Health and AIDS Prevention, Ms. Sue. Thank you very much, Sue Paget, for a very fantastic job you're doing with your team. Of course, our co-chair of SANAC, Mr. Steve Letsike, has spoken to us already. Very well appreciated comrade, and helping us also to wake up and do a bit of, liveliness of singing. From the CDC, Dr. John Blamford, thank you very much for always being there with us. And also in absentia, the UN country representative, Ms. Nados Bekele Thomas. Also from the Rotary, the international president-elect who spoke very passionately to us, very strong message. Please pass our appreciation, Sue. Ms. Jennifer Jones, we wish her all the best as she assumes the position of president of the international Rotaries. Dumelang magaeso, Melosi, batho ba Melosi. La ga le re go utlwa lebitso le le mola ba re lebitso ke lebitso ba re ke Gomora. Dumelang, re ka se change lebitso ka hore, what is in the name has got the history. Really dumedisa. Sanibonani. We are indeed very pleased as a department and ministry to be here today to continue this very successful and very important partnership with the Rotaries. I'm very glad to be here today on this Rotary Family Health Day of 2021. We know that we are still in the grip of COVID, and last year we couldn't even get a gathering like this. We did everything virtual. But at least today, this year, after going through devastating 3 waves of COVID-19, we are very pleased that the infection rate has gone down, even though with a lot of devastation, a lot of lives lost, a lot of livelihoods lost. But at least we are very pleased that today we can gather like this with the limited numbers, with all the safety measures. To come and indeed celebrate this day of the Rotary Health Day, celebrate this very important partnership with the Rotaries. We indeed value this day because we see it as part and parcel of our comprehensive provision of comprehensive health services. As already mentioned, even the president-elect and all the speakers mentioned some of the services which are always provided on this day, and very important in terms of our own plans. So we always, and even today, we appreciate this. And the very concept, because it's not only the people of Melusi today who are benefiting. Over the last 10 years, as has been indicated, this has been happening And I'm very pleased that our partners in the Rotaries are always very good in identifying very disadvantaged areas which we go to provide these services on this day as part and parcel of our Cheka Impilo campaign from the department and from SANAC. So we appreciate this partnership. Now, I need to also just mention that this is at this stage a very important contribution, because over the last 20 months of this COVID pandemic, we lost a lot of ground in terms of providing comprehensive health services. So much of our resources, financial, material, human resources were diverted at the pandemic. And in the process, we lost a lot of ground. And on a number of various evaluations which have been done, we have come to terms with the fact that in providing comprehensive health services, we have really gone backwards. Whether it be in terms of HIV and TB, STIs, non-communicable diseases, we are now in the mode of catch-up. And so this program of today, and I know that it doesn't start today, the work which we have been doing over the last few days and weeks contributes a lot towards our catch-up plans in as far as recovering comprehensive health services. As already indicated, we are in our 10th year of partnership, and we hope that this can continue, because indeed we have to build on the foundation which has been laid over the last 10 years. Now, of course, as we regain our footing in as far as fighting the pandemic on one hand, while recovering from the lost ground in terms of other services, partnerships like this are going to be very, very, very important. Of course, I'm very pleased that as we do this, we are not oblivious to the fact that we are not yet out of trouble with the pandemic. The virus is still in our midst. Every day we record a number of infections. It's only that it is at a low level of transmission at this stage. So at all times, I'm happy that even where we are today, we are observing all the preventative measures in as far as COVID-19 is concerned. Now, I'm very pleased also to know that as part of these comprehensive services today, working with our department and Gauteng, we're also making provision for those who are not yet vaccinated so that they can also get an opportunity, because this is our only hope of a long-term success in our elimination of the COVID-19. Because now, while we are on the elimination of HIV, AIDS, and also tuberculosis, now we've got a new pandemic, the COVID, and also we also need to make sure that it's eliminated. And at least in this regard, unlike HIV, we do have a vaccine. So the various vaccines, and we urge people to come forward to take these vaccines. But you are also pleased that today, on this Rotary Health Day, we're also making sure that we can provide a focused attention to our compatriots who are living with various disabilities, making sure that they can also receive comprehensive health services, including also vaccination against COVID-19. This is indeed making sure that no one is left behind. Now, we know that our President Ramaphosa, has been leading from the front in as far as making sure that South Africans have access to these life-saving vaccinations. As a country, we must be very thankful for the kind of leadership we have in the form of our president and the colleagues working with him, because many other countries, especially low-income and middle-income countries, and especially in our continent, are still struggling with access to vaccination. As of a few days ago, in the continent, we're still speaking about less than 6% of people in the continent having had access to vaccination. Now, we must be very pleased that with the kind of leadership, mobilizing resources and making sure that we have access. At the current moment, we are battling to make sure that I think in the next few days, we should be able to reach 40% of the adult population having been vaccinated, at least with one dose, if not fully vaccinated, of the 2 vaccines which we are utilizing. As of yesterday, we're sitting at just below 39% of the adult population, at about 38.8% of the adult population, as compared to many of our compatriots who are still struggling. And therefore, it sometimes becomes quite an embarrassment when, for instance, I will be out in a meeting with colleagues, ministers of health in the SADC region, and many of our colleagues in the very SADC region are still struggling to access vaccines for their people. Now we are struggling to get the people to come to the vaccine. When our compatriots in the continent and in the region are struggling just to get vaccines. We have the vaccines, we must try by all means to convince people to come and get the vaccine. We even take it to the people in many places, in the taxi ranks, in the malls, in the markets, everywhere. In the churches, we go there. But still, you know, because of the strong message of those who are discouraging. But I hope that working together with all our partners, we will be able to defeat this, because it is in the interest of all of us to make sure that we can be able to make sure that South Africans are covered, because we know that while the infection rates are low now, we've all learned over the last 20 months that it is not over, and that there is going to be another resurgence of the infection. And therefore, we must be ready and protect all our people. We are very pleased that these services which are being provided indeed have just fit in very well, as I said, within our own programs, and they contribute in a big way to our mission and vision of a long and healthy life for all South Africans. And we appreciate the role of the Rotarians, as mentioned by Ms. Jennifer Jones there. The Rotarians have a long history, including in the areas of vaccines. The polio vaccine played a very important role. And even now we're very pleased with the announcement that the Rotary International is working with Gavi and COVAX to make sure that many disadvantaged countries can be able to access the COVID-19 vaccines as well. So we believe that all this will contribute toward making sure that no one is left behind. We are happy that these programs which we are rolling out here today, also for disabled compatriots, it's making sure that information is available at the various stalls about non-communicable diseases, about sexually transmitted diseases, about HIV, TB, and we are certain that by the time that the services move to the next station, a lot of communities will have definitely benefited from this. And especially, we want to, again, appreciate the focus on our compatriots with disabilities, because indeed information is very empowering, and we are convinced that as we live from here, many families will also have benefited from the services which are provided here. So we want to call for all our citizens, members of the communities, the various members of society, leaders, that it is incumbent on all of us to make sure that we mobilize all our people to access the basic prevention, especially prevention services, checking, knowing your HIV status, knowing your blood sugar levels, knowing your blood pressure. All those will make sure that you can live a long and healthy life, and make sure that you can live a very productive life and avoid catastrophic illnesses, which can indeed make you unable to contribute productively to your family and to society. As I've mentioned, the fight against COVID is also really in our hands. We are pleased that while I've mentioned that we do have challenges, but we are very pleased that many South Africans have come forward to take the vaccine. As we speak, I think by the end of today, we will have administered just over 23 million doses of vaccines to just under 16 million South Africans. So it's still a long way to go from the 70% of adult population to be covered, because to reach 70%, we need to reach at least 27 million South Africans. So even by the end of this week, we'll still be short of just over 10 million individuals if we are to cover the 70% of the adult population. But we believe that as we see every day, thousands of South Africans still coming forward, we believe that as the message spreads, that this indeed is a life-saving vaccinations which can prevent you, if you get infected, from getting serious illness, from getting admitted to hospital, from ending up in ICU, and possibly from even dying from this disease. We believe that working together with all members, leaders of trade unions, traditional leaders, business, and all our civil society leadership, and all our partners, we are confident that indeed, when we reach the end of December, which is the target which we have set, that we should be able to reach the 70% coverage. We know it's a tall order, but we believe working together, we can be able to reach there. Now, at the same time, we want to recommit ourselves that working with our partners, we will indeed continue to try to reach the 1990 target. We know that already because of the pandemic, some of this we have already missed, but we believe that working together, we can still drive towards making sure that by the time we reach 2030, which is the target for the elimination of HIV and AIDS, we could, if not completely, but we'll be very close to achieving this in the same way as we also want to eliminate tuberculosis. So we want to again appreciate this partnership and the services, and also the fact that it goes beyond that. Also, as mentioned, the sexual and reproductive rights. And I'm indeed also very inspired by the message from Sandra about the fact that, as Steve also mentioned, when you talk about sexual and reproductive health rights, we must not think that people who are living with disabilities are excluded. And the fact that she mentioned that, in fact, her second baby came after the disability, I think it's a very strong message, not theoretical, but practical, that indeed, I think it's a message, especially for us, the providers of services, that we must not just think that people with disabilities only need to be assistive devices and all other support services, but they need to be supported to live a full life, including also in terms of sexual and reproductive health. So that message, I think, is very strong, and thank you very much for really emphasizing it. Now, ladies and gentlemen, as already mentioned, that part of also why we are here today is also to launch the World AIDS Day theme. So at this stage, I will want to just go to the World AIDS theme, which is in some small gadget here, which I must find. I was going to go to my electronic, but thank you very much. And that's why they say we've got a very smart CEO. She already could see that I'm going to waste time going into my PIN, my password on the iPad, and she already had it ready. Now, ladies and gentlemen, as you know, on the 1st of December, again, we will be commemorating the World AIDS Day. Here in South Africa, this is led by our Deputy President, who is our chair, together with the co-chair for South African National AIDS Council. And under the leadership of the Deputy President, on the 1st of December, we'll be commemorating World AIDS Day. And a theme has been decided and agreed upon. And this is the theme which I'm now going to announce for 2021 World AIDS Day. The theme is working together to end inequalities, to end AIDS, TB, and COVID-19. Get tested, get vaccinated, adhere to treatment. So this is the theme for our World AIDS Day. Now, this theme is aligned to the global theme, which is a message to world leaders to end inequalities and also end AIDS. It speaks to the colliding epidemics of HIV and TB and also the current pandemic of COVID-19, which are now colliding on all of us simultaneously. It emphasizes the need to test, to vaccinate, and to adhere to treatment, be it for HIV, AIDS, TB, COVID-19 therapeutics, since at the current moment, in all this, there is no treatment which puts an end to this, except for TB. If you adhere to the treatment on TB, it can be cured. But the others, in terms of HIV, AIDS, and COVID-19, it's really preventative, including vaccination. So this year's theme is also informed by previous themes, which were used to assess the journey of commemorating World AIDS Days over the past years. And also speaks to the need to work as a collective in our communities in response to HIV and TB epidemics, including the COVID-19 pandemic. This theme, of course, as I conclude, reminds us that we will not succeed against these pandemics and epidemics working in silos, that a comprehensive approach is the only thing which can make sure that we become victorious. We've got limited resources, financial, material, human resources, and COVID-19 has also taken so many of our very important, especially health workers. So we can only be able to defeat all these pandemics if we work together, smart, collectively, and in a very comprehensive way. Thank you very much.
Thank you very much. It's not my duty to thank the Minister of Health or anybody on the program. There is a person assigned to do that. We started this session late. And Minister, we have done Operation Catch Up. So we are now on time, where we should have been. We are really moving towards the end of this session. And we're going to have quick items. There is an item on the vaccination, as you see in the program, of a person with a disability is going to happen there by the minister. I hope you can still vaccinate, Minister, because I think you left clinical work. No, I'm saying that you are supposed to vaccinate someone. I hope you can still vaccinate because I know you left your clinical work many, many years ago. I remember that, so that will be, but I think he does know how to vaccinate. And Minister, when you say the vaccine is available to everybody, we moved around, Sue and myself, before we started, and we asked what vaccine they were offering. They were offering 2 types of vaccine. The other one is J&J, and we were told that those of us who received J&J need a booster vaccine. So we wanted to jump the queue and we asked for the booster vaccine. But the nurse said, no, you are not allowed. You have to go through the EVDS system and get your notification and then go to some place. So unfortunately, we can't get the booster vaccine. But we are going to move to that after the minister will open the plug. So where's the plug? Around here, okay. So I have to, because I'm moving one, two, yeah, with this one. So we will have to get off the stage, but I think let's just finish with all the formalities. And then once we go for the plug, we go for the vaccine, it will be all over. Ladies and gentlemen, before I call the person to do the vote of thanks, we have lost a lot of lives in South Africa and in the world. A lot of them, or some of them to COVID, friends, relatives. We lost a lot of them to HIV, to AIDS, quite a lot of them to TB. And you know, there are also a lot of them due to some cardiovascular diseases, which are also on the increase. So before we go to our various homes and places, can we just rise and observe a moment of silence? Thank you very much. Lest we forget. On that note, I will invite to the stage again Mr. Mutumoni Piti to do a brief vote of thanks. Mr. Piti.
Thanks, Program Director, once more. The Honorable Minister of Health, Dr. Joe Patla, distinguished guests, ladies and gentlemen, all protocol observed once more. I just want to first start by thanking our 2 program directors, Reverend Zoita Nebutaru and Dr. Jack Lloyd, for ably leading this program up to this point. And just to thank the different speakers who contributed to this program this day, starting with Ms. Paget, who reminded us that life is a gift and that service, leadership, and voluntarism is very significant in making a difference in the lives of our fellow human beings. Ms. Sandra Kumalo, who shared with us the plight faced by young and adolescent women living with disabilities, but also that living with disabilities has its own opportunities and possibilities that we need to exploit to the full. And she has shared, as the ministers just said now, how you can live a full life with disabilities. And we have also heard from Ms. Begela Thomas that we can make it, and that we are seen as pioneers as a country in the management of the COVID-19 pandemic, especially the whole government approach in the manner in which we manage this pandemic. Dr. John Blamford also spoke to us about the importance of screening for services, and that with regards to the management of HIV, how one pill a day can lead to undetectable viral load, leading to a person who's HIV positive to live a very full life. We have heard also from Dr. Tembisile Xulu in terms of how partnerships help us to bridge the gap between the haves and the have-nots in our different areas. Ms. Jennifer Jones also shared the work that is done by the Rotary Family Health, and then the work in particular around the move to get Africa declared polio-free as a response to the call by our then esteemed president, Mr. Nelson Mandela. We heard from Ms. Steve Litzige as well about a truly multi-sectoral activity that we're experiencing here today, and then that we need to tear down inequalities to reach everybody in need. And we can see from the multi-sectoral representation here that we are moving towards that. We also want to thank Dr. Hongwana, representing our MEC, Dr. Nomatema Mokheti. And you can see that throughout this day, the theme has been partnership, collaboration, pledging of solidarity and support for this process and program that we are busy with. And lastly, I just want to thank our minister for sharing with us around the need for comprehensive health services, and that these services are not only for able-bodied people, but also for those living with disabilities. The need for Chega Impilo, that we need in terms of preventive services to screen for the different conditions so that we can identify this early and be able to manage them before they become a problem. The importance of this program that we are launching here today as part of addressing the backlog that was created by the focus we had on COVID over the last 20 months, where we lost some of the impetus that was created in terms of addressing other comprehensive services. So this takes us back to moving towards breaching that gap that has been created through COVID. We have heard that within the next few days, we could be reaching 40% vaccination of our adult population. And the message that while we talk about taking services to the people, we are also taking vaccination to the people. So all of us spread the message that we need to vaccinate wherever we may be, because vaccination saves lives. I just want to take this opportunity to thank all of you for being here, and members of the media as well, for for covering this event. Thank you very much and have a great day.
So we have been sitting for a very long time. We have come really to the end of the session. I'm going to ask us to just rise where you are and allow the people on the stage to go down and go and open the plaque first. They will sanitize this microphone and I'll give it to the minister. And then, oh, she has to say something. Okay. So Dr. Kulu, you can say something, but otherwise we go down, we do those two items, and that would be the end of the session today. Thank you very much, Dr. T.
Thank you so much. Thank you, Mfundisi. I'd just like to read from the World Health Organization's page, which clearly states that all health workers involved in implementation of COVID-19 vaccination need to have adequate knowledge and skills in order to ensure safe and efficient COVID-19 vaccine administration. The COVID-19 vaccination training for healthcare workers package is available and developed for frontline health workers in all countries, and it's been developed by UNICEF together with the WHO. So our honorable minister is going to get a course from Usista Tsepiso Ndlambe. Please give. So please be assured that when the minister administers the vaccine, he will be trained. Thank you, colleagues.
Okay, colleagues, can we go down? Sizojika izinto wena ukhalela sizojika izinto wena ukhalela sizojika izinto wena ukhalela na wena ukhalela zijikile izinto wena ukhalela yezinto wena ukhalela
Thank you very much. Thank you very much. I'm going to read the plaque, the Rotary Family Health Days 2021. This plaque was officially unveiled by Minister of Health, Dr. MJ Patla, MP, on Friday, 5 November 2021, to amplify government commitment to ensure no one, including people living with disabilities, will be left behind with COVID-19 vaccination programs to save lives and achieve population immunity. Thank you very much to
We also change lines.
Oh, that's nice. What a badge. Now for the course.
I must go for training.
Where's Sister Ndambe? Yeah, there she is. Where? For the minister. We are asking now that we are done there with the vaccinations, we are asking, sorry, the people who were on the stage to go back to the stage. We needed to do like 2 vaccinations, but let them go back to the stage for a group photo, please. Go up the stage. Minister, you're supposed to go back up the stage after this one. Okay. And then once you get that group photo, those of you who started at the briefing room needs to go back to the briefing room. Okay, they said for you who have got cameras, the minister is administering this one. So get your cameras ready. He's fully trained now. Fully trained. Get ready, get ready. And those of you on social media, please just tweet. Go on tweeting whatever. Instagram, let it get viral. It must go viral, this event. Tweet, retweet, everything. That's to. Now, cameras, get ready, especially the media, get ready, get ready. There goes the minister. There is the minister getting back to clinical work. You can see he's a doctor, man. He knows his stuff. Yay! Let's see if there is no reaction to the minister's vaccine. Okay, those who are on stage, can we quickly go up to the stage for a group photo, please? Those who were on the stage, let's go back. Hurry. Is it?
Yes, because I mean, Jennifer Jones is like, because it's a historic moment. This is a historic moment, the first cloth that the minister unveiled. Yeah, so the people are excited.
Can I invite those who are on stage, our speakers as well? Please come. You might not have been here. Please come. The stage did not have enough space, but come. Let's just get a group photo. I think Dr. Jacques, are you okay? Okay. No, he says he's not feeling that well, so it's overeating.
because I'm gonna run out. Yeah, this back one.
You might want to come out of there.
One more chair.